Hello, my name's Stephen Lightfoot and I'm the chair of the NHS Sussex Integrated Care Board. And what I'd like to do over the next few minutes is to give you a very brief summary of some of the key discussion points at our NHS Sussex board meeting held in public on the 23rd of July at the Aldingbourne Country Centre near Chichester. Now, we started with a couple of reports from our Deputy Chief Executive about the current operational context, because there's a lot of change going on in the NHS and it's important to keep everybody updated. And as part of that, we took the opportunity to thank our staff who are working in very uncertain situations at the moment while we're waiting for organisational design decisions to be made. We also took the opportunity to thank our HealthWatch colleagues, because it's also been recently announced that HealthWatch is going to be closed in the coming years. And we've had an update on their 10-year health plan. And the good news there is that actually our Improving Lives Together strategy is very much aligned to those longer term ambitions. So there'll be no major change as far as that's concerned. We got an update on industrial action of our resident doctors. And again, it's important that we understand that the national direction is to minimise the number of appointments that are cancelled. And so that actually having a plan in place for that is going to will be important. And then we took the opportunity to get an update on the progress of establishing a new Sussex and Surrey Integrated Care Board from the 1st of April 2026, and the intention to set up a new board in common from the 1st of October 2025. But while the organisational change is ongoing, it's also important that we maintain a focus on the in-year performance. And we had reports from our Finance and Outcomes Committee, our People and Digital Committee, our Remuneration Committee, our Executive Committee, and also a brand new integrated commissioning report that really provides all of our performance information in one place. The good news is we've got a really solid increase in the number of GP appointments. We've got a good performance when it comes to 4-hour waits in our urgent and emergency care pathways. And also importantly, our money is on track. So we're very much looking forward to that continuing. 2 areas of concern that we need to continue working on, and they of course include minimising long waits for planned care and also ensuring that we get a good and rapid and safe discharge of patients from hospital who no longer need to be there. We had a really good paper on children and young persons' mental health services, and that follows a children and young people's engagement event that we held on the 1st of March in Brighton with over 50 young people attending. And actually what the paper was all about was actually how are we going to respond to that patient and public feedback and to improve our children and young people's mental health services in the future, and a really good discussion on that. We also took the opportunity to talk about the strategic direction for the Sussex health and care system. And that was important because actually we come towards the end of completing our work on designing new care models for our urgent and emergency care services, also for our rehabilitation and intermediate care services, and continuing to develop our 13 integrated community teams across the Sussex footprint. I think when that's combined with an intention to publish our commissioning intentions for the next financial year at our September board, and also we'll be starting to build a medium-term financial plan to make sure our system remains in a financially sustainable position. We took the opportunity, as we always do, to look at corporate governance documents as well. Our Audit and Risk Assurance Committee confirmed that what they've done was to approve our annual report and accounts for the last financial year, and they'll be published in time for our annual general meeting, which will be held on the 3rd of September. What we also did was to look through our new board assurance framework and also updated some of our corporate governance documents to ensure that we've got everything in order before we transition to a new integrated care board. So there's a lot going on, and I think it's fair to say that I'm really pleased with the progress that we're making both short term and long term, but there's still a long way to go. Our next board meeting will be on the 24th of September. So thanks a lot and see you next time.